Have you noticed that with aging, many things change with the upper face? Besides the obvious forehead and frown lines, have you ever looked at someone and wondered why their brow bone is so prominent, or maybe they have sort of a peanut head, or that they have sunken temples, making the upper face look a little bit like a skeleton? This is one of those subtle areas for volume loss where we can tell there's aging of the face, but we're not quite identifying why. I'm Karen Whitney, board-certified physician assistant at Advanced Cosmetic Surgery and Laser Center and trainer for the Allergan Medical Institute. I'd like to share with you the good news that there is a solution to this type of upper face volume loss, that being injectable fillers. But wait a minute, you might be thinking, my provider said they cannot treat my upper face with fillers. That is correct, unless you're an expert and experienced injector and have the appropriate training. So here's my approach to rejuvenation of the outer aspect of the forehead. Most deficiencies are greatly improved with the use of Juvederm Voluma, a lifting filler with 2 years duration. It can be placed under the temporal muscle, which is one of the chewing muscles, and it provides lift to the temple area. Treatment can take more than one session to gradually restore volume to this area. After treatment, mild tenderness can occur for the first day or so because we've stretched that muscle just a little bit. When the volume loss is more above the brow bone, a softer filler such as Juvederm Volure or Volbella can be used. Placement is often with a cannula, which is a rounded tip needle that I use to avoid the risk of bruising or damaging a blood vessel. Now you know what's going on with the upper face volume loss, and this is how to improve this common concern. Be sure to choose an experienced and well-trained provider, and let me know if you have any questions.